Today, we're talking about one of the most overlooked factors in reproductive health, and that's stress. When stress becomes chronic, it changes how our hormones function. If somebody tells you that, oh, stress doesn't impact fertility. Of course it can. It's not ovarian failure, but it's all because of the brain interpreting what is going on. If you see a bear, your body is going to shift its response in order to allow you to run from the bear. It's causing inflammation. This is what's happening to the brain before everything gets shut off completely, but you might miss these red flag warning signs. Welcome back to the As a Woman podcast. I'm your host, Dr. Natalie Crawford, and today we're talking about one of the most overlooked factors in reproductive health, and that's stress. We live in a world that constantly demands more of us, more productivity, more energy, more resilience. And while our minds may adapt, our bodies often pay the price. When stress becomes chronic, it changes how our hormones function, affects our menstrual cycles, and can even make it harder to get pregnant. In this episode, we're going to cover how the stress response system actually works and why it's tightly linked to your hormones, the way chronic stress impacts our ovulation, egg quality, and fertility outcomes, and most importantly, what you can do to reduce the effects and restore hormonal balance if you've ever been told, just relax or it will happen. This is the episode that will help you understand what stress is really doing inside your body and how you can take back control. Well, friends, thank you so much for being here today. And this is a topic that I am talking about to all of my patients right now and getting so many questions on. And it's interesting how often people actually get dismissed if they bring this up to their doctor and they really are told just relax or don't stress about it, or that infertility or trying to get pregnant is just inherently stressful. And that might be true. It is stressful to go through infertility. I had multiple pregnancy losses. I know what it's like to be on that side of the table and truly feel the stress that comes when every month isn't ending the way you want it to. But that doesn't mean that our world is not inherently stressful and that we don't need to think about what is happening inside our body every single day when we make certain decisions that are not setting us up for success. So let's dive in and start talking about what is really happening at a cellular level, because I know that you're smart enough to understand. Let's start by revisiting the menstrual cycle very quickly, because we're going to lay the foundation for the stress axis, which is very similar to the ovarian axis. So if you remember, we have the brain, which has the hypothalamus and the pituitary gland, and they work in tandem to talk to the ovaries to make estrogen and progesterone. So what happens in your menstrual cycle is that you've got a group of follicles outside the vault ready at the start of a month. The brain is going to send out follicle-stimulating hormone, or FSH, from the pituitary gland. But really, FSH is stimulated by GnRH from the brain, from the hypothalamus inside the brain. And the hypothalamus is that central command station. It is interpreting signals from all over your body and then making a decision about what should happen next. So it'll send out a pulse of GnRH to the pituitary gland, which will then send out FSH, which will talk to the ovary to get the ovary to start growing a follicle. So FSH is actually a well-named hormone. FSH is going to get that follicle to grow. As it grows, it will make estrogen. Estrogen talks back to the brain to tell it a follicle is there. And then the brain will hear that high estrogen sign and send out a surge of LH, or luteinizing hormone. LH will allow that follicle to rupture, the egg to be released, and then the follicle will reform and become the corpus luteum, making progesterone for the second half of the cycle, known as the luteal phase. Well, the corpus luteum can only last for about 2 weeks. If you don't get pregnant, the corpus luteum dies, progesterone levels drop, and then you're going to get a period. A new group of eggs will be outside that vault, and the process starts over again. We call this the HPO axis, the hypothalamic pituitary ovary axis. Well, there's also an axis called the HPA axis, which is the hypothalamus pituitary adrenal glands. The adrenal glands are small glands that sit atop of your kidney, so you have 2 of them. What the adrenal glands do is they actually make tons of hormones. They make hormones important in your sex hormones, they make hormones important in salt balance, but they also are very important in the stress response system. And we have to remember that our bodies are meant to respond to stress. Even evolutionary, when we think about the type of stress we'd experience, there's 2 main types: acute stress and chronic stress. And what happens is that if your body would encounter a stressor, your body needed to be able to respond appropriately for whatever you needed and whatever adaptation happened in that stressful system. And so there's 2 different pathways that this would happen. And let's compare the 2 to seeing a bear or being in a famine where there's no food. The acute stressor is the bear. And what your body needs to run away from the bear is very different than the adaptations your body needs to survive if you're living in a famine. So some of the hormones that the adrenal glands make can be versions of adrenaline and cortisol. So these are commonly thought of as our stress hormones, even though they're made in slightly different circumstances. Modern world's not as simple as seeing a bear or living in a famine. We actually have so much overlap between acute and chronic stress, and this is a huge contributor to interfering with hypothalamic function. If we think about the fact that hypothalamus is hearing the hormone signal from all over your body. So it's not just listening for estrogen, it's also listening for cortisol, and it's listening for other hormones, and it's interpreting all of them together to then tell your body what to do. We really do a disservice when we think about our body segregated off into these different organ systems. Or if somebody tells you that, oh, stress doesn't impact fertility, of course it can. We're relying on the same network in the brain to interpret these signals and then respond. So let's just think about these two different scenarios in a really simple fashion. If you see a bear, so suddenly you see a bear, your body is going to shift its response in order to allow you to run from the bear. And a few of the things it's going to do includes shunting your energy supply and where blood is going. So you don't need to ovulate or digest if you need to run from a bear, but you do need to have enough glucose, which is sugar, available for your cells. So glucose is the fuel of your cell. And so when you have an acute stressor, your body is going to shift so that glucose is freed up and in your bloodstream. This is going to allow you to be able to fuel your cells and run from the bear, and then that glucose will get used up, come back to normal, and when the stressor is over. So we really are thinking about wanting to fuel that increased heart rate, your lungs' ability to breathe, giving your muscles the fuel that they need. However, in a constant stressor, like a famine, you have a similar adaptation at first, but then when your body is getting constantly stressed, the hypothalamus starts to not be able to rely that you're going to recover from this stressor. So if we think about living in a famine, when the stressor never goes away, the brain starts feeling like, well, I am not able to handle my own body functions. I'm not sure we should get pregnant or carry a pregnancy. And so one of the things that starts to happen is that the hypothalamus starts shutting off the pathway to the HPO axis, feeling like that is a more elective option than some of the other essential options for life. And you'll start not sending out hormones from your pituitary gland, therefore not ovulating. In addition to storing some of that glucose so that it'll be available for you later and putting on some visceral fat, even though you might not have enough calories in other places. So when we think about chronic stress and acute stress, they really are overlapped, even though the system that gets you there is a little bit separate. I like to think about these scenarios as very obvious extreme endpoints, meaning a famine and a bear are very obvious things for us to wrap our brain around. But in reality, the stress that you're experiencing most of the time is probably different. You probably are getting an email from a coworker, or you're in a meeting, or you get bad news to the doctor, or your fertility treatment cycle didn't work, or you have a fight with your mom. There's a variety of little things that constantly cause us to have both acute stress and then they build up to be chronic stressors. When we think about it this way, we start to realize that one, by the nature of what's happening in the HPA axis, cortisol, one of the primary stress hormones, is actually a pro-inflammatory hormone, meaning it's causing inflammation. And it's doing that on purpose because you need to go run from the bear. But when you don't run from the bear and you have all this glucose out in your bloodstream and your insulin levels start to raise, your body starts to shift what's happening on a cellular level, and this chronic inflammation starts to build up because you're never actually running from the bear. We just have this stress level that gets compounded on each other. Well, this causes both chronic inflammation and insulin resistance. Insulin's a hormone I talk about a lot that a lot of people don't understand, or they think just matters if you're diabetic or pre-diabetic or have PCOS. Insulin is the gatekeeper to allow glucose to get into the cells. So if we think about it very simply, when you eat food, the food gets broken down, you now have glucose in your bloodstream. Or if you see a bear and your body frees glucose up from storages, suddenly there's glucose in your bloodstream. That glucose can't be used unless there's insulin to open the door. And I use the really bad analogy of imagining that insulin is like somebody knocking on your door, a salesman. You open the door, let them in. Well, if you're constantly having an elevated blood sugar for a variety of reasons, so in this example from stress, because your body is freeing up glucose from storage to get into your bloodstream so you can run from a bear that doesn't exist, your body will start to make more insulin in response. But just like you will stop answering the door if that salesman comes and knocks on the door every single day, your cells get the same way. They are sick of seeing the signal. It becomes less effective. And this is what insulin resistance is. Now the salesman has to be banging on the door, or you need very high levels of insulin in order to get the door to open. Well, this is part of the problem contributing to how stress can have a multi-layer impact. Not only does it interfere at the hypothalamus level, think of it like interference or static on the radio, that chronic inflammation. You have the hypothalamus's direct response to seeing stress, meaning prioritizing other body functions, which can impact how your hormones are made. You also then see this tendency towards insulin resistance because of freeing up some of this glucose from storage. So now this insulin resistance is going to impact our egg quality as well. So we see that egg quality, ovulation, proper hormonal function, all fall on the pathway of what can happen when we have higher levels of stress. And this is both acute and chronic stress. But for most of us in modern life, it's both of these. Well, one thing that I think is important to understand is that the extreme of this is well documented. So even if your doctor may not talk about how stress is important, and we're going to dive into the nitty-gritty, hypothalamic amenorrhea is well established as one cause of infertility or menstrual cycle problems that everybody will admit chronic stress can play a role here. So if we go back to the famine example, what will happen is when your body's not getting the signals it needs, the hypothalamus makes an executive decision. We are going to shut off ovulation. You can't get pregnant right now. I don't think you can support a pregnancy because we're so stressed, or we're in a calorie deficit, or we're over-exercising, whatever might be happening. And the hypothalamus shuts off GnRH. Therefore, there's no FSH or LH coming from the pituitary gland. And then we see in the ovaries, there's no response. So the ovaries are not out of eggs. They're still releasing eggs, just there is no signal from the brain coming because of this hypo, which is affectionately what it's called because it's hypogonadotropic, meaning low gonadotropins, FSH and LH are gonadotropins, hypoestrogen, meaning low estrogen. So you have low hormones across the board. It's not ovarian failure, but it's all because of the brain interpreting what is going on. It's not just an on-off light switch. There are shades of gray. It's a dimmer switch. So well before you get to, we're going to shut everything off, of course the brain has a different response as we start watching. And this is where a lot of us miss the opportunity to intervene. So a good example here could be runners. We know that runners have a higher incidence of having a luteal phase defect. Well, what's a luteal phase defect? It's the first stage of ovulatory dysfunction, and this is when your luteal phase is less than 11 days. So if we think about this, you're normally ovulating if you're tracking your cycles, marking your cycle day 1, you're going to detect that you're ovulating, and you'll sit across from me and you'll say, I'm ovulating just fine. But if we are tracking the day you ovulate, and I know now how long your follicular phase is, or the first half of the cycle, and how long your luteal phase is, or the second half of your cycle, suddenly I know now, hey, your luteal phase is short, and we actually are having the first stage of ovulatory dysfunction. This is what's happening to the brain before everything gets shut off completely, but you might miss these red flag warning signs if you don't know how to look for them, or you're not tracking your cycle, or if you're on hormonal contraception and you can't track your cycle. In the example of runners, I use the luteal phase as a great way to have them titrate what they're doing. So I have a patient right now and we just froze eggs. She's running a marathon. She's not on birth control pills. And she wants to know, when is her running getting too much? And what we're doing is tracking her cycle. And as her luteal phase starts to get too short, we know we have to switch what we're doing and prioritize more weight and resistance training and less of the longer run, because that's the sign that her body is getting too stressed. She's not seeing the perfect balance that she needs. So we can learn to leverage our body as a sign when we start understanding that the choices we make every day, the world around us, the stress levels that we experience do in fact impact not just how our hormones function or our ability to ovulate, but our cellular health inside our body and our levels of chronic inflammation and insulin resistance. Stress is one of those things that is hard to study. And it's something that patients will ask me for all the time. Well, can you check a cortisol level and just see if I'm stressed? And actually, it's not quite that simple. And I think that's an important thing to realize, because cortisol varies throughout the day. It is normally highest in the morning naturally, and then it's going to change throughout the day. And I want you to understand that sometimes a simple blood test is not telling us the truth about what's happening inside your body as well as you can tell me or learning to look for those actual physical clues that it can tell me. There was actually a really great study done published in Human Reproduction looking at couples who were trying to get pregnant. And these were couples without infertility. So we could argue that hopefully trying to get pregnant was not a stressful event. They had not been trying very long. They had no issues, and they did not enroll in the study for infertility. They just wanted more data about their bodies and their hormones. So they tracked their cycles, and there were a variety of different blood and saliva tests run to look at it. So this study was a prospective study. So patients were followed in the future, which is one of the best ways to try to watch natural fertility because we don't want to be intervening. Now, over 500 couples were in the study, and what it showed us is when we were looking at some of the stress hormones, cortisol was not a great marker, both of perceived stress matching with its levels, but another marker called alpha amylase actually was a better marker. And women who had elevated alpha amylase levels actually had a much lower chance of getting pregnant and a higher risk of infertility, meaning their monthly chance of getting pregnant was 29% lower, and their rate of infertility was more than double. Remember that infertility is not getting pregnant by that 12-month mark. So this study is telling us that in women who are trying to get pregnant and couples who are trying to get pregnant with no known issues, having this higher stress level, whether it's by a blood marker or by perceived stress level, actually can be associated with physiologic signs that can show it can be harder to get pregnant. So this isn't just a just relax situation. This is something that I want you to really understand so that you can control. The problem is that stress is not as obvious as a bear. It is so endued in our day, and so much of the foundation of our day actually sets us up for failure, meaning how we exercise and the sleep we get are two crucial factors that we do not address very often that might start us in a deficit every single day. And if the signs of stress are not, I see a bear right there, well, what are they? It can be feeling fatigued, having irregular cycles, having a short luteal phase, having a high heart rate or feeling anxiety, feeling depressed, having headaches, low energy. These are all things that you might deal with every single day. And you might say, I have all of those symptoms. But that's not really a normal way to be functioning. And this is your body trying to get the signal to you that it is not functioning in its optimal state, and that potentially this is a place where we could intervene. I think it's really important to acknowledge there's a huge mind-body connection here, meaning what you're going through and how it impacts how you feel physically. Of course, we have to acknowledge that your mental state impacts your physical state, but also that there's a huge invisible load that women carry, especially if you are listening to this and you're trying to get pregnant or you have infertility. None of this means that infertility is your fault, but I want you to see this as a data point that your doctor may not be talking about that you can actually do. Because every single day patients ask me, well, what can I do? And is there something more that I can do? And often they want, a magic pill or they want something easy. But often I say, hey, there's a lot of little things you can do that actually can change your cellular environment. And if we start thinking about what's happening when we're chronically stressed, understanding the chronic inflammation and the infertility, now you're in a position to start making changes to combat those without having to go down the pathway of taking pills or medications, but simply by the choices you're making. And I like to approach this as both a preventative and then a response. And what I mean by that is if we say the world is stressful, every single day you encountered stress, it is unrealistic for me to sit here and say, create a low stress life and quit your job and set boundaries and make it so that you do not encounter stress. That is not how the world is, and that's not going to be a successful endeavor. Instead, I want you to say, I'm going to encounter stress every day, and I need to have a built-in mechanism to try to prevent this from overwhelming my system. And I need a coping mechanism for when I encounter those acute moments for what I can do. Instead of just saying, I'm going to try to create this day where I don't have to see stress, therefore I don't have to deal with it. We're going to flip our mindset to say, this is coming, but I have a plan. Because if you know anything about me, I love having a plan. So now we're going to create a plan together. First of all, if we look at our life and we say the world's stressful around us, I want you to have a moment where cortisol, that inflammatory hormone that's going to free up glucose from places, gets lowered. I want your cells to get less used to it. I want your body to be more sensitive to it. I want to give you a break. So what I want you to do is think about how are we every single day, regardless if you think you're stressed or not, going to carve out 20 minutes to lower those cortisol levels. And what that is that's going to be different for you and me. But we want to really search for that feeling. I want you to feel the release. Feel when you feel better. Most of us actually know when we're feeling stressed, when we're feeling overwhelmed or overworked. And so this 20 minutes is time that you can carve out and give to yourself. And there's a variety of things that you can do. This could be going for a walk, meditation, mindfulness, breathing, feet in the grass, talking with friends, talking to a counselor or a coach. It could be yoga or acupuncture. There is not one right way to do this, and it doesn't have to be done the same way every single day. But you need a way to decompress. Some of my favorites include morning time outside. Something about hearing the birds always does it for me. And journaling with the brain dump. Having a piece of paper in the morning, getting all of your thoughts down on that paper, freeing them from my brain really helps me start that day in a clearer headspace. So those are just two strategies, but there's many other things that you can do to try to decrease stress. Some of these have added other benefits as well. Acupuncture, yoga, exercise, those can have additional benefits. But sometimes you can't carve everything out, or you don't have an appointment, or you might feel like something's too big a barrier. So if you sit here and say, oh, I can't get to that, I can't pay for that, I can't afford it, there is something that you can do that does not cost money, that is going to help you lower those cortisol levels every single day. And I want you to think about it and start to carve out time in your day to do that. I also want you to think about how you can eliminate stressful things where you can. If it's toxic friendships, if it's muting people on social media who are causing you more stress, is it saying no to certain things if you are overworked or overwhelmed? Is it asking for help? Because I know there are people in your world who will help you if you allow them to do so. And so look at the things that do cause you stress, especially stress without the reward. And how are you going to have a strategy to maybe make that a better change long-term? What I really want to think about is what happens when we encounter stress and how do we deal with this? And if we go back to my favorite bear analogy, when you saw a bear back in the day and cortisol is elevated and glucose was released from storage into your bloodstream, it didn't just sit there causing chronic inflammation. It was a temporary transient state. And what would you do? You would run. You would run as fast as you can to get away from the bear. And you would use up every drop of glucose that was in your bloodstream. It would go into your muscles, go into your heart. You would be pumping it out, and you would get back to a state what we call homeostasis or balance. But that's not happening when you get the bad email at work, or when you have an encounter with somebody, or you get really bad news. You just sit there and you absorb it, and glucose gets released, has nowhere to go, and insulin gets released, and you are just ticking and adding up to these different encounters. This is something I want you to think about. How are we going to do this? And I've got two recommendations. Of course, you have to think about what's going to work for you, but two things I want you to think about. One is going to be thinking about trying to lower your heart rate immediately, breath work, really trying to find whether it's a mantra or something you can do. Is it box breathing, where you're breathing in for 4, holding it for 4, breathing out for 4, holding it for 4. Another one that we like, or that we like in my house, is if you kind of are counting and breathing along with your hands. So move your hand up and down, breathe in and out to a count of 5. Just try to give your body a moment to reset. But the other thing that I think we don't do enough is go use our glucose up. So if you get out of a really terrible meeting, it doesn't mean you have to go run from a bear, but can you take a quick walk? Can you just go take a moment away? Can you walk around? I have my kids go jump on the trampoline when they get upset. I said, hey, you get upset, you're trying to overcome from it, get outside and jump. You've got to use up some of that glucose, try to get you back to normal. If you can't, if you're at work, can you shut the door to your office? Can you do squats right there? Can you move your body in some way to use up that glucose? And what I don't want you to do is lean on coping mechanisms that are going to worsen the circumstance. And what are those? Eating, stress eating, especially eating processed foods or junk foods. We go eat this type of food looking for a dopamine hit, trying to cope with our stress. But what's going to happen? Well, that bowl of Lucky Charms is now going to raise your glucose even more. You're just adding to the stress. Or alcohol or other toxic behaviors. That whole, I had a stressful day, so I deserve a glass of wine at night. And that is going to cause more inflammation in your body, and it is not appropriately helping you in the moment deal with that stress. So thinking about helpful stress mechanisms that you can know about for when you encounter stress, how you deal with it, in addition to setting your day up in a way that is going to be more protective against you. And the last couple things I want to say here is when it comes to sleep and exercise. Sleep is when your cortisol is going to naturally change. Melatonin is an anti-inflammatory hormone that is opposite of cortisol. I like to think about sleep as when your body is going to go and clean up. It's when it's going to handle all of that chronic inflammation. So if you had a very stressful day, staying up late and drinking wine at night is probably the worst thing you can do. You actually should put a face mask on, try to get in bed earlier, take a warm bath, because getting more sleep is going to be one of the top things you can do to combat that stress and start the new day in a better mindset and cellularly with less insulin resistance, because your insulin levels, your glucose levels are both going to lower overnight. So not eating right before bed, not drinking alcohol, getting at least 8 hours of sleep, that is going to be one of the top things you can do to really help your body recover. And then when it comes to exercise, the reason why getting up and walking and using some of that glucose can be helpful is that skeletal muscle allows glucose to get into cells without needing insulin. It's like giving the salesman a key to the door. Suddenly, we can just open the door and glucose can go in. So building skeletal muscle and using skeletal muscle are extremely effective ways to help your hormonal balance, because it's going to lower insulin resistance and lower chronic inflammation. And this is why strength and resistance training 3 times per week should be a part of your life no matter what, but especially if you're a woman, a reproductive age woman who wants hormone balance or wants to get pregnant or has infertility or is in perimenopause or is in menopause. Building skeletal muscle and using your skeletal muscle, one of the top things you can do for your hormonal health. And so I want you to think about exercise not as this, I need to go run and get rid of the stress. And I'm guilty. I love running. This is one of the top ways that I have for my life dealt with stress. And it's not that you can't run at all. And it can be a great way to go run from the bear and deal with an acute stressor. But building up more skeletal muscle over time is going to prepare you to be able to use more of that glucose effectively. So set up your day with an exercise program that does have strength and resistance training at the core of the heart of it. And then the other days, do what feels natural to you, do what you like, and allow yourself flexibility to deal with different circumstances day to day. You can't eliminate stress completely, but what you should do is reframe how you think about it. Stress is inevitable. Chronic stress is modern life, and you need to spend some time thinking about how your body responds to the world around you and what active choices can you make to set up a day that's going to be more hormonally healthy. And this is going to be with your sleep, with your exercise, with some of the stress reduction practices that you establish. But more than that, what are you going to do when you encounter stress, when you get bad news, when you have the bad work meeting? What coping mechanisms are you going to lean on? Because if you don't think about this and come up with a good plan, you're going to revert to all the old ones that we know are just adding on to the inflammatory burden that your body's experiencing, ultimately wreaking havoc on your hormones and making things harder for you. So regardless if you're trying to get pregnant or not, this is a topic that every woman needs to focus on, because I know you want to be your healthiest self, and you can't be healthy unless your hormones are really functioning as they should. And stress is a huge component. So thank you guys so much. There's more information about stress in my book, The Fertility Formula, which I would love it if you guys would buy at nataliecrawfordmd.com/book. There's a lot of pre-order bonuses you can get with it as well. But this is something that I think you're smart enough to understand the science behind it. And once you understand the why, you'll now be prepared to make changes. So thank you, friends. Thank you for listening to the As a Woman podcast. If you're ready to take control of your reproductive health, my new book, The Fertility Formula, is your next step. It's a science-backed guide to understanding your hormones, optimizing your fertility, and owning your reproductive future. You can order your copy and learn more at nataliecrawfordmd.com/book. And as always, follow along at Natalie Crawford MD for even more support, because knowledge is power, and your health deserves a formula made just for you as a woman.